Good afternoon, everyone. Welcome to the March 5th, 2026 Rockingham County Board of Commissioners meeting. Call the meeting to order and ask everyone to rise. I pledge allegiance
To the flag, the United States of America, and to the republic which stands one nation, under God, indivisible, with liberty and justice for all.
All right, we have a full house of attendance of department heads and we have all three commissioners, Commissioner Cabral, Commissioner Godu, and myself, Commissioner Coyle. So we'll move right on to RFP openings and awards and start with the award for the commissary services inmate accounting system.
I'll make a motion to award the proposal for commissioner. Let's say commissioner services, but commissary services inmate accounting system, Keefe Commissary Network LLC at no cost to the county, as recommended by the superintendent.
Second.
Discussion? Just a quick question. It looked like the commissary rate is like, is 28% to the inmates. Is that pretty like standard for the standard rate? I was just curious.
So it depends. So the competitor had a slightly lower percent, but higher prices for the inmate. So
Yeah.
it ended up being more cost effective for the inmate.
Yeah. Okay, just curious. Any other discussion? Hearing none on the motion, Commissioner Godu?
Yes.
Commissioner Cabral?
Yes.
And I vote yes. Second motion.
Motion to approve the Keefe Commissary Network LLC services agreement at no cost to the county for the period beginning March 2nd, 2026 for 3 years with automatic renewals for up to 2 consecutive 1-year terms thereafter, and authorize the chair to sign all necessary documents as recommended by our new superintendent.
Second.
Any discussion? Hearing none, Commissioner Tombrello?
Yes.
Commissioner Godu?
Yes.
And I vote yes. Next, we have the award for duct cleaning and for facilities.
I'll make a motion to award the proposal for to Kitchen Clean Inc. DBA Air Duct Clean for the assisted living community on units NRT-1, 2, 3, 4, and 9. FCU 02, the Dietary Air Long-Term Care Services Facility, including the Dietary Department and offices, Dish Room EF-52, and the Dietary Makeup Air Unit for an amount not to exceed $5,550.
Second.
Do you want to read the second? Yeah,
Impact Services for the Department of Impact Services for the Department of Corrections, D Block and D Shower Exhaust for an amount not to exceed $1,800 as recommended by the Senior Director of Planning, Facilities and IT.
Second.
discussion?
Well, it seems like a lot of work for not a lot of money.
Yeah.
Right? When you think about that, they're gonna go in there, and I've seen them do that, go in there and brush over, that's a lot of duct work for that.
We have it done every 5 years, so the access panels are already there. These guys know us. They know how to make their way around, especially in the jail, so.
Notably, it was just, there's huge variations in pricing. I mean, just
Every year,
unbelievable.
it's crazy, and the
That's the
same
bid.
people quote every year.
And the bids could be so disparate, but anyway,
We do mandatory walkthrough, we take them through, we share plans with them, they know what they're looking at, so.
yeah. All right, any further discussion? And then just that we are using the lowest, all of these were the lowest bidders. On the motion, Commissioner Godu,
Yes.
Commissioner Tombrello,
Yeah.
and I vote yes. Next, we have the award for fuel, number 2 diesel, LP and diesel and gas.
I'll make a motion to award 1-year fuel contracts for the period of April 1st, 2026 to March 31st, 2027 to Haftons Energy Group as recommended by the Senior Director of Facilities Planning and IT, including number 2 ultra low sulfur fuel, large drops at a fixed rate of $2.64 per gallon. Number 2 ultra low sulfur fuel, small drops at $2.69 per gallon. Diesel fuel at Rack Plus, 45 cents per gallon, and LP gas at Rack Plus, 35 cents per gallon.
Keep going.
Further move to.
Run out.
I'm still looking at the pricing. Further move to accept the late gasoline proposal from East River Energy due to documented email and to award the 2-year gas contract for April 1st, 2026 to April 1st, 2028 at rack plus 0.1221 cent per gallon in year one and rack plus 0.1246 cents per gallon in year two.
Second.
Discussion.
They didn't really test me today.
I just, Commissioner Tamburello, you did an excellent job. You did an excellent job. There's a lot to it. But I will say, I think we need to, I mean, like, let's lock this thing in, given the instability with fuel. I feel like, can't say yes, lock this.
60 cents this week, every day to.
Yeah,
Price up.
I mean, you can speak and that,
Even diesel went up 40 cents today.
we have no idea
So,
what.
And it's all speculation. It's got nothing to do with reality.
We had a gas delivery today and they did not go up. East River Energy is our current vendor and they did not increase our cost yet, but today they didn't, is what we, so.
So,
I have a couple of questions though, just for clarification. What does rack plus mean?
There's a posted rack every day at Sprague and over in Portsmouth. It's the daily rate, whatever is being charged that day when they go and fill their tankers up and bring them back, that's rack, it's a posted rack. The gasoline rack is posted in Revere, Mass.
Okay.
So sometimes we'll get it fixed and sometimes more often than not, they want to give us a rack plus. If the price goes up, our price goes up. If the price goes down, our price goes
So
down.
this isn't a guarantee. If gasoline goes up, we
We're
pay
paying
extra.
more. We're paying
On
12
the
cents.
on the
Rack,
rack,
over rack.
yeah,
which would affect the gallon.
Yes, for sure.
But on the heating fuel,
On the heating fuel, we've got a fixed cost for the first 2 years. Diesel is a rack plus and
Yeah,
LP is a
LP.
rack plus.
Yeah.
That's all they quoted. They didn't want to talk fixed.
Well-
And some years we can negotiate for rack plus, but a ceiling, they were not interested in that right now either. We tried.
and what's the difference between large drops and small drops?
Shake drops over at the nursing home and 8,000 gallon.
Or
drops.
the amount that
And
they
the small
bring?
houses.
not the,
little
that's the
ones.
part of.
I'm thinking like, what is the?
We're talking
Okay.
about-
Large and small deliveries. Okay, those are all my questions.
Thank you.
Oh, we did yeah. All right, Commissioner Tombrello,
Yes.
Commissioner Godu.
Yes.
And I vote yes.
Thank you.
Next, we have the consent agenda. First, the February 26 meeting minutes.
Make a motion to approve the February 26th public and 2026 public and non-public minutes.
Second.
Discussion.
They look good to me.
Thank you, Leila.
Thank you.
On the motion, Commissioner Godu,
Yes.
Commissioner Tombrello.
Yes.
And I vote yes. Next, we have a surplus equipment request pursuant to New Hampshire RSA 28A with respect to long-term care savings.
I'll make a motion to approve a surplus equipment request pursuant to New Hampshire RSA 28:8-A and declare 30 televisions from the Driscoll 1 and 2 units and long-term care services surplus.
Second.
Discussion. These TVs are over 10 years old and get out of date and ready to be moved on. Some of them will be sold, right? That's the plan. Okay. On the motion, Commissioner Tombrello.
Yes.
Commissioner Godu.
Yes.
And I vote yes. We have a second related motion to this.
Make a motion authorizing the sale of surplus televisions to county employees for a nominal fee of $1 to $5 with the remaining televisions to dispose of property and the funds raised to be donated to the residential efforts fund.
Second.
Discussion. Great 2 for 1.
It's,
Everyone,
you pay them $5. It probably costs us $5 to get rid of it.
It's more than
Or
five.
more, right?
yeah,
Yeah.
I think it's close to like 20
It
bucks.
depends, yeah.
Yeah, okay. On the motion, Commissioner Godu.
Yes.
Commissioner Tombrello.
Yes.
And I vote yes. Next, we have the March 5th, 2026 accounts payable list.
I'll make a motion to approve the March 5th, 2026 accounts payable list for $3,884,893.78.
Second.
Discussion? Well, we had some expensive, when I was looking at, it, we had 1.6 for the state bill. We had 400,000 for Sodexo. We had another 700,000 for, Cigna. So, here we are, we just hit like nearly 3 million without even,
those three.
with 3 items, so, those are the big ticket items. Otherwise, some of the usual. You can see some reduction that we have like in our, I mean, we can see some of that inverse relationship if you look at. Where we're trending on long-term care for contracted nursing,
Right.
yeah, we are seeing that a little bit, so. On the motion, Commissioner Tombrello, Commissioner Godu?
Yes.
And I vote yes. Next, we have reports. Anyone, commissioners' reports?
We have Zoom meeting tomorrow for recruitment. I've been in touch with, folks, the, coordinator from Derry, for Pinkerton. So we'll try to include them as well. Not in the Zoom meeting. He seemed to, I sent him the positions that were open. And, he's interested to learn more. So it's good that they have an interest.
Yeah.
So any extra new recruitment for both, correctional officers and LNAs. Those are good resources.
Great. Commissioner Tombrello?
I had a few things, so I had the chance Monday and Tuesday, I worked up in Maine as an electrician, because I'm an electrician, so I actually worked in 2 nursing homes, doing lighting in 2 nursing homes, both of them called Pinnacle Nursing, one in Canton, Maine, and one in Portland, Maine. I spent one day at one and one at the other, so Chantel's not here, but I had a little discussion with everybody today. We really have something that's incredible, because they were nursing homes, but I don't want to say anything because I showed them how to get on YouTube to watch me today. So I have to say nice things in case they decide to look, but it's amazing what we have and amazing what others could have. When I ever showed them and got them to go on YouTube and actually look at our facility, what we have here, we really have going on here. You know, we talked to them, they're not union. I talked to both administrators. I wanted to talk to them while I wanted to do lights. And I spent probably a half hour with both of the administrators in their office, just talking about what we're doing here and what they're doing. And, you know, their staffing is an issue with them, not as bad as us. I'm kind of surprised that they're only a couple of people off, but they're a private nursing home and they're for profit and they're non-union. So what they're doing, they had assisted living. The first one, the one in Canton, Maine, Pinnacle had 109 people, and the one in Portland had 60 people. So it's a smaller version. The one in Maine just looks like it had babies, like it had an addition and an addition and an addition. And it's, you know, it's old sprinkler system and just really not. So when I ever told them what we had here, they were amazed. But I love talking the lingo with them. They were pretty receptive to it and talking to them. So that was that. Then I came in today and I met with Allison on some reviews that were going forward. I met with the superintendent on some budget issues going forward, which the superintendent and I have talked almost every day since he was hired as a superintendent. He didn't know that was part of what was going to happen. We've had many conversations and concerns about a budget that, you know, the superintendent is gonna have to deal with and bring forward to us. So we looking at some options and looking at the bullet points of what the drivers are in the budget. So I was driving here and he said, "Are you driving?" I said, "Yeah." He said, "Just be careful what I'm about to tell you." And I feel pretty careful. I also, today when I got here, I went over the nursing home. I wanted to go in there, you know, I love being over here, but I miss the old people. Unfortunately, I went over there to a mask mandate. So I kind of just grabbed lunch, but I did see some people actually walked in the old smoking room. You know, for as long as I've been here, that was the old, well, the gym was the original smoking room, and then it was a little version of a smoking room because we didn't want to take the smoking away from the people. So all of a sudden, I see the room is all up and bubbly, and there's a lady, a young woman, I guess. Oh, what is she going to be? I always get yelled at. A young lady, Dalton was the last name. I didn't get her first name, but yeah.
And she is the staff scheduler for long-term care.
Searching got a nice little office, seemed real happy to be here. I didn't know she was up there, but I miss, I love being over here, but I miss the nurse, I'll be right up front. I miss going in there, maybe, because Monday and Tuesday, I was actually playing games with the people in the nurse home. They had this big round thing where you had to throw it, and the people were just fun. So I love being here, but I miss being over there.
And really nice, they might reserve you a room.
I'm gonna come here, I'm not gonna go there.
It's worth noting though, Commissioner Tombrello, that you really have such a nice rapport with, like with people generally.
My age,
People over.
my age.
Temporary.
No, I love it. I just throw the ball and one of them didn't stick. And they had 3 balls. You had to get all the numbers. So I just
Get ready to go in.
I'm not done.
Does this have to do with bingo?
And one of them, I've determined that one of them is a trick ball. That's a trick ball, but non-stick. So, and then I met, go ahead. You want
No, I was here, but you take the floor.
But I really do. And you guys know, I love the old people. I love it. And I still think of Brandon. I think of all the different ones, and Rita and all the different ones, Andy. Well, but anyway, and then I met with the new cleaning people come by my office. I said, come on in here. But we started talking about this building, and now that they're here for a couple of weeks and how things are going, talked about the shifts that they're here. There was a guy on the first shift, I talked to him, and then the supervisor came in and I said to him, I do have one concern, and he was telling me that they actually don't get a bucket truck and they don't get ladders on the side of the building, that there's actually a new gadget out there where a drone, they will rent a drone to clean the windows on this building. So a hose goes to the drone and a guy stays down below, and I told him I want to be here when I see it, but the drone goes up and they do it with the joystick, the drone machine washes the windows on the outside, so there'll be no bucket trucks, there'll be no, that's what he told me. I
Well,
said,
No, I will never ask.
but I want to be there for it, but I mean, the technology too.
yeah,
Yeah, it makes sense, I mean, why can't it, if it can do all the things the drone are doing, but.
I'm skeptical, but.
Yeah. Hey,
Hey,
they got the contract, right? We're gonna have to clean windows.
Yeah, because I told the supervisor, he's one of the guys, he's here just to kind of oversee it, get it up and running. And I told him that was a big concern I had, that I think everybody's way off on the bidding costs. And he said, no, we're not gonna rent those and stuff. We're gonna have a drone. There's a drone that's out there that does the outside windows.
yeah, I just Googled this. It does exist.
Yeah, and last week I know the state rep,
Sure.
Mike Edgar was here and he talked about, us getting out. And about tonight, I'm actually meeting in my hometown, with 20, residents from my town and Danville, just to talk about county issues. So I'm excited to meet with them tonight. So, and that's it.
You sure? Thank you so much. I mean,
Taking up Chantel's not here.
I did say to her last week, she took Wednesday off. I said, take Thursday off, and I don't believe it, but she listened to me. She's not here. I did tell her that last week,
I think it is worth saying though, that I do think Commissioner Tombrello, you bring a lot to the nursing home and your sort of making yourself present to the residents is very meaningful over there. And you've done that for the course of your tenure here, and it's really a wonderful quality. So moving on to my new business, I mean, really, we're just like getting into the part of budgeting, and I think there's been a lot of discussion with department heads about their budget. I know that we're planning for the budgets. Their department heads are gonna have their budgets done by the end of March. So it's only like TikTok, it's only a few weeks away, and I'm sure, I know department heads have been working long before now to get them ready. We understand it's gonna be a challenging year, I think, and we're seeing that everywhere, right? Just and similarly with the uncertainty in some of the things going on in the world with, fuel and inflation. And so, I think what I feel confident about are 2 things. One, that I know that everybody's put a lot of thought and effort into the budget they're gonna present, and that we will all work together to try to do the best for the county.
One little thing, just union negotiation. Monday, we'll have our first meeting with maintenance Monday morning. Get that going. We met previously on, we thought we would propose first, and then they'll be coming in, it'll be our first get together over here on Monday morning, so. We'll be seeing you at the Union Studio.
Yeah, we meant to do some initial financials on the union, but we haven't had our official first meeting with the union yet, but that will be next Wednesday.
Excellent. And I don't have any negotiations this year, which is.
You did yours. You made up for it last
I
year.
know, last year I was, I had quite a few, it just comes in, just the waves it comes in. Okay, we can move right on to facilities operations, there's a, request to reject the proposals and republish the RFP with respect to jail sprinklers.
I'll make a motion to reject the proposals received for the real sprinkler head replacement RFP and authorize republishing the RFP as recommended by the Senior Director of Facilities Planning and IT.
Second,
Discussion,
why are we rejecting these?
we got one bid, it didn't come in, it was not, there were a lot of question marks, and so we want to send it.
Wasn't right.
And the more interest we got, the higher the price went. We started off at 20 and we're up to like 169,000. So
Okay,
I want to go out, I'm gonna have it looked at. It may end up being a request for capital for next year, but I want to know exactly what we're looking at. There's been a lot of mixed messages from vendors.
and well, how come we didn't get people to bid on it? Just happens.
Well, we had a couple of people show up and then, one of them, they don't want to work in the jail unless they can put in a crew of 3 and. Sometimes the jail's a little bit more of a challenge for some vendors that are used to doing like schools.
Yeah.
So we walk them around, we tell them what the requirements are, and sometimes it's just not palatable for them. We'll find someone. I just want to make sure that we have a realistic number
Right,
before we go forward.
right. What you don't want to do is get enough where we like all of a sudden it just ticks off.
Exactly
and all of a
right,
sudden-
and that's what was happening.
Yeah,
Thank you.
thank you. Do you have any other questions?
No.
On the motion, Commissioner Godu?
Yes,
Commissioner Tombrello? Then I vote yes.
Thank you.
Next, we have some Harvey Construction AP warrant.
I'll make a motion to approve the March 2026 account payable warrant T261070 payable to Harvey Construction Corp. in the amount of $157,280.70 as recommended by the Senior Director of Facilities Planning and IT and the Senior Director of Finance.
second,
Discussion? The number's slowly ticking down.
Yeah, a little bit more than a quarter of this was towards the North Road Water Main project, so part of it was ARPA, so it's good that we're using more of that last bit of ARPA money.
Yeah, I mean, it's really all worked out. I sometimes when you step back, you're like, can't believe we got this project done on time. And right, it like was able
So
to,
many, yeah.
I know, so many projects, like utilize our, it just like, thank you, thank you. Thank you. All right, on the motion, Commissioner Tombrello,
Yes.
Commissioner Godu?
yes,
And I, yes. Next, we have the congressionally directed spending application for the sheriff's office.
I'll make a motion to authorize the finance office to apply for the fiscal year 2027 congressionally directed spending on behalf of the sheriff's office for amount $2,091,604.70 for a New Hampshire waterfront emergency response and security network, also known as WERFEC, as recommended by the Senior Director of Finance and the High Sheriff.
second,
Discussion?
I'll defer to the sheriff of the major to talk in detail.
So this is kind of like a regional impact project that doesn't necessarily just direct us, but the county is the most appropriate thing to apply for it. So it's actually would create almost an inland waterways, separate radio channel. So huge benefit to communities from Seabrook, Rye, Portsmouth, everywhere up the Great Bay. And as well as those towns that are on the main side. It essentially would establish a waterway channel. So if there was an incident, on the high-rise bridge where you have a jumper or some other emergency that happened in all of those communities, they would have dedicated channel that the Coast Guard, Marine Patrol, State Police, all those communities could jump onto to communicate together instead of trying to jump between the channels. But it also offers an opportunity for us if they implement that infrastructure. It would allow us to put in different antennas and stuff to make our radio network infrastructure a little bit more robust, and it would actually put infrastructure out on the Isles of Shoals that would allow when they're doing search and rescue in the ocean for any of those communities of the Coast Guard. So it would allow an opportunity. So it's a big number thing, and it could end up going as high as 5 million based off of estimates if they approved it. But there's a much more likelihood that it could get passed because it's such a multi-jurisdictional benefit, multiple states, multiple communities, multiple counties, the way that it goes up the inland waterway. So we said that, we kind of spearhead this to see if we can make it possible for the Seacoast.
Great benefit for the county.
Absolutely. The question I just have is, but it seems like it's a benefit for a lot of agencies, and the only thing I had is because it seems like the request would cover the entire cost of the initial infrastructure, but my only concern is sort of the significant impact to the ongoing maintenance. It says something like 200, this is annual maintenance cost of $200,000 in county budgets. So is that, essentially puts a,
That's and that may be something when we look at the project as a whole, and that's why we kind of wanted to apply for it to see what the feds are going to be willing. Are they willing to, earmark something for those different upkeep costs? And those are the things that, we'd have to look at if that project went forward. Is that something the county wants to share? Or are they going to tell, hey, these other communities, this is a bigger convenience to you, so there'd have to be something set up where you'd have to pay for that ongoing maintenance. Because for us, it's really just attached, it's more antennas to whatever infrastructure goes on. But absolutely, we are aware that we don't want to become holding the burden for the complete infrastructure. Like it would have to be buy-in from all those other communities.
fair enough.
Yeah.
That's fine. I just
But yes, we're not looking to say, hey, we're going to take this on for maintenance in perpetuity.
yeah.
We said
that's
we'd be the spearhead to get this rolling and then see how all these affected communities would be willing to put in. So, and the Seacoast Fire Chiefs, I know have a meeting looking at this coming up within the next week or two, where they want to give some feedback and input on as well.
yeah, I just we have obviously been dealing with it was ALS services and how challenging their funding is to
Yeah.
get buy-in from the community. So I see this, and the only concern I have is I don't think, this is a really great benefit. There's no doubt, the cost is significant for.
And we're looking at it.
So
If it's not a fit, it's not a good fit.
Yeah, and it's just, we're just, the way that the grant funding works, kind of the county's the entity that has to apply for it to even look at it, so. But yeah, no, we're not looking to saddle us with an ongoing cost for decades.
It's not that.
So we're not signing up for a $200,000 increase in perpetuity. Okay.
This is just the first step to see what's possible.
And I think that we've been submitted by Friday, right?
Yes.
Yeah.
It is a long journey before it finally becomes a grant, an
Yeah.
actual grant,
Yeah,
like another COPS grant.
yeah.
We'll just have to, stay down.
But we'll keep an eye.
Venture,
We'll
nothing to-
we'll keep an eye on it. We'll keep you posted. If it's gonna be a cost, it's.
That's something else. Okay, any other?
Nope.
On the motion, Commissioner Godu?
Yes.
Commissioner Tombrilla?
Yes.
And I vote yes. Next, we have human resources, we have Mergis Healthcare Staffing Incorporated Contract Buyout Agreement.
My motion to authorize the senior director of human resources to sign the Amerigus Healthcare Staffing Inc. invoice for the contract buyout for 2D.
Second.
Discussion?
So Craig.
Great. Again,
Another
LPN, this is
LPN.
another LPN.
They're a great fit and they've been working well, and I was able to negotiate the price down by having them finish out their contract. So it brought down the cost even more, so it's only 4 extra weeks, so it was a good move.
Yeah, it's great. Thank you for your efforts.
Yeah, no.
Again, just all what we're trying to do, so. On the motion, Commissioner Tombrilla?
Yes.
Commissioner Godu?
Yes.
And I vote yes. Next, we have the remaining holiday discretionary bonus gift card post usage.
I'll make a motion to approve the utilization of the remaining 7 Amazon gift cards for future wellness activities events through the end of fiscal 26 at the discretion of the senior director of human resources and recommended by the senior director of human resources.
Second. We have discussion, I guess, sorry, people that are taking. This is,
I understand decided to use this for wellness, but I'm wondering if this is better used for like some kind of awards internally with the the staff, we could have an employee of the month or year, or each department have an employee of the year and give them, but I don't know.
Whatever you want to do, obviously, if we do any wellness initiatives, we bring them before the board for consideration and approval. These were gift cards that people did not want to have them because of tax implications and stuff like that, so they chose not to receive them. If you want, we can do it. There's only 7, so I don't know if everyone would have an opportunity to have one. If we do a more wellness thing, it goes into a pool and everybody has the opportunity to participate and receive something.
It's gonna be a random drawing.
It's always, we actually do a Wheel of Fortune thing. It's a electronic thing, so everybody's name goes on this wheel. And it is electronic and it spins around and it stops. And it's what Eileen got forward. So
I wanna be there.
It's not real.
no Vanna White, there's no Vanna White,
But we have Tom.
but you could, if you wanted to designate 5 for something like that, and we could maybe use a couple for wellness initiatives, the last couple that we have coming up, it's up to you. I just wanted to make sure you knew we had these and they're out there, and I don't want them to go beyond this budget year. We should utilize them in some form. So there's some division directors here, and I don't know if you want to ask them, they want to, I don't know.
My employees love the contests and getting their names put into a raffle. Like, they make sure, did you complete your thing? Did you do your thing yet? Like, they compete to get into the raffles. They like them.
Yeah, that's a reference to like fund or something. I like that, I like Wheel of Fortune.
I don't know, but I understand if you want to recognize somebody that has gone above and beyond or something like that.
Well, we have our own internal employee of the year, officer of the year, things like that.
I was just gonna say, long-term care has the Rockstar Awards, so every week we're recognizing employees who get written about. A leadership group votes on them, and then they receive like a small coffee or a muffin or like a treat of their choosing, so we do that every single week. And like Jude, there's lots of conversation in long-term care and assisted living. They're filling out the quizzes and have you seen the email? Did you see the picture of who won what? So they do get very excited about a raffle. Everyone loves a raffle.
Oh, okay, that keeps employees happy, that's good.
But good thought.
No, I think it's because HR just wants to be able to do what the board wants us to do, but also ask for your input.
Can I spin the wheel?
But
No, it's a perfectly good question in contemplation, just stuff like, oh, we guess you look. That's fine.
That's fine, I'm good with it.
On the motion, Commissioner Godu?
Yes.
Commissioner Tombrello?
Yes.
And I vote yes. Next, we have a use of facility request.
Motion to approve the request for the use of the lobby conference room and waive the facility fee for the HR affiliate group from NHAC on Friday, March 2026, from 8 to noon.
Second.
Discussion? Hearing none, Commissioner Tombrello?
Yes.
Commissioner Godu?
Yes.
Next, we have utilization of Cigna Wellness Fund for gym equipment purchase.
Take a motion to approve the purchase of 2 new pieces of fitness equipment from the Precision Fitness Equipment, utilizing the remaining Cigna Wellness dollars as recommended by the Senior Director of Human Resources.
Second.
Discussion. So we took 2 pieces of what cardio, brought them over here, and now we're gonna replace those with the new ones what's there. Is that right?
I do have a piece of equipment, it's going to be a stepper. And we will replace one of the treadmills, and we're using the same sports start, so it'll mirror the equipment that's already in there. It's a high quality equipment, it's maintained very well, and we'll use that for them.
Sounds good. Any further discussion? Hearing none, on the motion, Commissioner Godu?
Yes.
Commissioner Tombrello?
Yes.
And I vote yes. Okay, move right into department head updates. I'm gonna start my right today, Jen. How are you?
Good, how you doing? So I guess my appointment to the Nurse Advisory Board is official, I guess yesterday went before, GNC, so. Let's see, there were several DOC grant opportunities that came up. recently. I think, Superintendent was on the email as well. Kevin Warwick, actually, who's a consultant on the national level and worked with the prior superintendent many times over, including up in Carroll County. He sent around the email, and strangely enough, with some of the grant opportunities, I'm like, wait, several of these are ones that are on the newsletter thing that Madison's been putting together, that Molly, I think,
Wow.
had started
Yeah,
back in the day. So I think they're resurrecting one of the prior ones that have been worked on as well. So be sure we have a head start on some of the narratives. So that could be significant and help defray some of the costs as far as opening up community corrections. So that'll be good too. The federal government, I guess, had changed the threshold for capitalization policy for use of federal funds. They increase it to 10,000. So I'm just recommending, if the board's okay, that during our budget process, we'd always said that expendable equipment is really for those items that are $500, but less than 5,000. So we're not trying to keep in mind different capitalization policies, because whenever we have a grant, we have to worry about that 10,000 being the capitalization threshold. I'd rather have it go 500 now, but less than 10,000. And now the non-expendable equipment line 53502, will be anything that's 10,000 and over. So I'll send around that, if the board's okay, as an email blast, because I know we're in the middle of departmental budget month. And so if you just modify your budgets accordingly, so I think it'll help out, because I think several things, I think John, I was mentioning, commercial washer dryers, those are easily between 5 and 10, not necessarily over 10. So, because I think recently, like in the last few years, you had a replacement of one.
Correct.
And it was like just over 5,000. So,
and it would be nice to mirror some of the New Hampshire, like, step in terms of our approval.
yeah, as far as bid threshold has been changed.
Yeah, it's
The
nice.
bid threshold is even 10,000 on the state level too.
Right, so,
Yeah.
but the bid threshold with the federal.
Yeah, so it works out well. So if the board's okay, I'll send that around, and I'll make sure that the delegation understands too. I don't think there's gonna be an issue.
Yeah.
So we're just getting alignment with the Fed rules, so we're not trying to follow more different sets of rules. Yeah. Overall, just very busy on many different things. Thank you.
We're busy as normal. We're currently obviously working on the budget. We also got notice on, I think it was Tuesday, that our VOCA grant is doing a different process this year, where it's going to an RFP instead of being kind of invited as an application. And the deadline is in 2 weeks. So Chuck's been great in helping me get the finance portion of that application. We're gonna hopefully have it on for next BOC meeting, because the deadline is the following Thursday. So we're working on that, and like, just working on budget and kind of moving forward.
Why is that grant process changing?
So they had got a reduction in money,
Yeah.
and the way that they're changing moving forward to RFP is because they're trying to do give out to more underserved communities. So they're, I think, funneling it out to a third party to review the grant instead of the DOJ internally doing it. So it's kind of like a little different process that we're kind of used to,
But does that mean we're at risk of not getting the grant this year? And how are we, like, when will we find out, and how does that relate to budgeting?
So that is a great question. I've been talking to the DOJ and Rhonda, I can't think of her. Bushman. And one of the questions that they ask is, are you a current VOCA recipient? And currently we're under an ARPA grant, not a VOCA. So I clarified with them that, are we still considered VOCA recipient? And she did say, please write that you are, so that you're an incoming applicant retrying for the same type of grant. So in addition to your other questions, I don't have those exact answers, but so
That makes sense. All right, thank you.
yeah, you're welcome.
Kendra?
Hi, everyone. The census over at long-term care today is 144 residents. There is a resident on the skilled floor that does have COVID, but they were admitted with COVID. So it is not an in-house acquired COVID case. Census over at ALF is 48. Unfortunately, they do have 2 staff members and 2 residents that are COVID positive, and that is all in-house. So we're actively working through that right now with testing. We follow the process for that. Chantel has diligently been working on the budget, lots of meetings over the next 2 weeks to kind of button everything up. So that's going great. And then we are tomorrow will be the last day that we're wrapping up our annual education and training plan to make sure that we're fully compliant with all the rules and regulations.
Great, thank you.
Superintendent.
The
Oh.
current count at the jail is 195 as of this morning. We just spent the last 2 days going through our NCCHC, so the National Commission for Correctional Healthcare audit, which we have to do every couple of years. So this year was unique where normally you have the medical audit and then you have the OTP audit is on an off year. Well, we did them all at the same time this year. So it was a whirlwind, and they had 2 lead auditors. Don't recommend it. There was a lot of confusion back and forth between who did what and things like that. So we did well. Last time we had an audit, we had two deficiencies, and the way that works is you get a deficiency, and then in 30 days when they send their report out, you have 60 days to rectify said deficiencies to maintain your certification. So we did have a few deficiencies, but they were more clerical. So all we have to do is essentially take a snapshot. Like one of them was sharps in where they're normally kept. So the last auditors didn't have an issue with where they were kept. This one did, because every audit is a little bit different. So literally all we're gonna do is take that and move it into the cell that's unused and just close it, and that's the fix. So what was really, really heartening to hear though is the both lead auditors, the OTP and the medical auditor, said how amazing our prime care, our custody staff, for how we do our diversion protocol for our MAT and the OTP, and just the care that all of the inmates receive. And they're like, we wouldn't have expected something of this caliber in little old New Hampshire. So I thought it was really, really cool. So
Do you think that the sort of just the change in the way that individuals are classified and housed is helpful in terms of getting that, or is it more just related to?
no, I mean there is some of it. A lot of for custody staff, this isn't really a huge lift on us. It's more prime care, but
Yeah.
our training they lauded that as well, how amazing it was. And one of the auditors was actually a competitor. Until recently, until last year, she was a competitor of Prime Cares, and she was expecting to come in being bitter, and she left with a really, really great view of them and how we do things. So yeah, it went well.
Good news.
And just like everyone else, the budget process, I'm jumping in, feet first, because it's while I've been exposed to it and helping here and there along, it really is now me being immersed in it. So I'm very fortunate to have Catherine there with me to help out, and the other departments have already reached out for a couple of things, and Chuck and Jude both extremely responsive. So I really appreciate it. That's all we have.
Jumped in with high profile, quite
Yeah.
detain, individuals in custody and.
Absolutely unreal. Sunday was the first second official day. And I got a call from the booking department. Hey boss, by the way, this is who we have in custody. I'm like, are you kidding me? Are you kidding? So no, we're handling it with aplomb though.
Yeah. Thank you.
Did you give Jason a Christmas card last year?
I did.
Probably not get one this year.
Well, again, he only lives 10 minutes from me, so there'll be a couple of visits to discuss things.
Yeah, and Jason,
No riots, okay?
when I talked today about the deficiencies, like, when I went over them, it's like 6 of them were pretty minor, little clerical things. So the first, we said, we talked about the budget, we talked about the deficiencies, so it's a lot of work, but it's workable. Workable, so it won't be fun.
Thank you.
Jude, good afternoon. All's well in facilities. I don't have a lot to report today. Situation normal, we're busy, we're budgeting. Well, number 4 was started up today. So we'll be taking tests there 3 months running, meaning we have to run it per week, bring up a round of tests up to DES, and then a week and then up. So right now the iron level is as expected through the roof. It was very high when we were testing, but we had to put in the wall so we could build this building. So we're watching that. We'll keep an eye on it. It may affect, the chemicals we need to put in next year's budget. That should be about the only effect. Once it goes through the plant, the water quality is exceptional. So it's very, very good. North Road Lift Station is almost done. We'll be taking training on that next week. The lift station at the jail is probably a month or so out because we have control panels that haven't come in yet. Dealing with some roof leaks here and there, especially over the warehouse and dietary. It's a flat roof and the drains are clear, so we're kind of chasing it, trying to figure out. You know, you get so much snow and then when it partially melts down, it's hard to figure out where exactly it's coming from when it's melting, but we're chasing it. We've been chasing it all day. And that's about it as well. I took my test yesterday for underground oil storage tank operator. And I passed.
It's terrible.
It was exciting.
Oh, yeah.
Yeah.
Oh, my God. Did you?
Just-
I mean, it's not 100. I am jealous because I got like an 85.
I skipped.
We need to get some study notes.
Next time I'll take it with her.
Exactly.
Oh,
Good study buddy.
That's all I have
Congratulations.
today.
That's really great.
Yeah.
Sheriff,
Well, I'm very thankful to be into a new building where we don't have to deal with all the snow on our roof and all the water coming in. So it's very nice to be here. Yesterday we were in Concord, New Hampshire. We actually, the executive council, recognized our drug task force for all the hard work that we've been doing. So it was nice to be with the governor and the executive council. And it was just a great event. We have 4 new hires. We have 2 experienced dispatchers that are coming to work for us. And we have a new bailiff and we have a new from the civil office. So we're getting there. Otherwise than that,
And yeah, our 2 deputy vacancies, they're just, well, what, their backgrounds are all done. It's just the hold up getting the psychological appointments. That's the biggest setback is timing for that.
and, you know, Autumn did that job here, which was, and I attended that too. We had a lot of good applicants in, and we do have, once we can get these people trained up, we might be able to hire some newer people, so I'm never gonna say that we're fully staffed over there, but we're actually in a good place.
yeah,
It's
So
been-
thank God,
And we're getting 2 dispatchers that have over a decade of experience each.
which is phenomenal,
that's unbelievable.
When you bring them through that building too and show them their
But
work,
you know what, that's the thing,
that's a
because
selling feature.
we've interviewed a lot of people for dispatch, and listen, it is what it is that was over there, but now that we're in a new facility, it's not only with the dispatches, but it's with everybody that works throughout the organizations. We're bringing in other police departments and everything else. It's just like, just having this auditorium over here and everything else the county has offered. It's, you know, Rockingham County is a professional, organization. We're professional. And this building is like, it's so much easier to work in. The attitudes of people that work for us are not stuck in closets or whatever. They can actually do their work, lock their stuff up. I mean, just the simple things of like having locker rooms and showers. Now they have their own locker rooms, so they're required to leave all the uniforms in there. But I'm talking too much, not like Tom, so.
Oh, no, Major Terry.
No, that's what's going on and it's been great. It was nice having the job fair here. I think that was a really great presentation. And like you said,
Right.
for the dispatchers, you can, hey, can we show you around for a minute? Let us show you where you might be working.
Right, it is a selling feature, so we might as well exploit that.
No, but it really is, it's phenomenal.
Yeah.
Even when we think, you know, to have NHAC come to affiliate, HR affiliates will come here and see it. The different counties, you know, I met the sheriff and said the Saturday was at that conference Tuesday in Concord for the legislative conference, the Merrimack sheriff.
Yeah.
And I think he's scheduled himself to come over here and see it. And every agency's been telling him about what Rockingham has. And we've seen it in the nursing home, but just seeing it, you know, we really are the driver in the Cadillac. I mean, there's 10 counties. They've called on us forever. I don't know how many times, Jude, we've had visitors come over and look at the atrium. And they wanted to do something that would be a replica of our atrium. And to see these other groups come over, Kathy's coming over with the NHAC.
Secret, yeah, you had the sheriff's, you had the.
We had the.
Chiefs of police.
But
Yeah.
we are,
You had the-
so instead of going to the police academy all the time, Sheriff Wright is the president of the organization, so
what he's doing is we're trying to go to all different sheriff's offices. And I can't wait for them to come here.
Oh,
They'll be all jealous.
Let them come here last. Let them come here last.
We're very fortunate, thank you.
Thank you. Julie?
Yes, okay. Hello. I don't have anything to report, but I do have something under new business, so I will talk to everyone later.
Great. Stay tuned.
Yes. Yeah, just budget. We've had some personnel things. We are, we're doing some revisions to, PCNs and stuff that all of you will get a taste to. And we're also working on evaluations, new formats and stuff like that. That's coming along pretty swiftly. And we'll be doing some of that. We have partnered with the payroll office and over the last few weeks, and we are going to be doing a training session on just general things that kind of have gotten pushed to the wayside, but just to bring those people that are in each of the departments that are doing some of this stuff. We're gonna roll that out and go to each of the departments and have like a small training session, and we're hoping that's gonna happen in the next 3 weeks, like to announce it and do dates. So it's been a lot of collaboration with the payroll office and finance office and ours. So we hope you'll enjoy the training sessions and stuff. Great, well, thank you.
Thank you, Allison.
Layla. Hi,
Hi.
I don't have anything, thank you.
There was so much lead up. All right, let's move on to new business, old business, and we'll start with the Walk-In Medical Solutions LLC amended rate sheet.
Don't you guys want to hear from the deeds office? Hello?
Kathy.
Well, you got your video off. We didn't know you were there. We were looking.
No, my name was on the screen. Don't even go there with me, Steve. Anyway, business as usual, guys. Thank you.
Come down the stairs, Kathy. Come down the stairs. I have my apologies. That was clearly, it's so filled here in this room that, anyway. Christine. You're on mute.
I told, no, business as usual. Thank you very much. That's all. Thank you.
There's a lot of fanfare for very little output. Anyway, all right. I assume that I see Erin Coker is here, but I presume that you've managed.
She's good.
She's.
Erin, do you want to say anything or?
You said it all.
You guys are muted.
You hear us, Kathy?
I hear you now. Yep. Thank you.
Amendment to the service. Is there any difference? Commissioner Barbara. Commissioner Barbara.
Yes.
Next, we have a weather emergency going to PVP open floor from today, January 7th, 2020. I'm sorry, March, I said January. March 7th. In relation to the March 5th, weather emergency. Is a motion, Commissioner Godu?
Yes.
Commissioner Turnbull?
Yes.
And Julie, do you want to take on business?
ATO is bringing some informational item forward. Gallagher's preparing for an upcoming benefit renewal, and they are working on looking at different items, and they've requested a proposal from Quantify. Quantify deals with specialty infusion therapies for things like chronic conditions or rare diseases. Looking to possibly propose to add this on to our Cigna plan for the upcoming plan year as an optional item. The benefit with Quantify is that a majority of these specialty infusions can be administered at home rather than in the hospital or a specialty center, so that would be greater savings to our plan. So for this proposal, Quantify would use actual data. So like diagnosis data, cost data, in order to illustrate what the savings would be had Quantify been in place for us in our plan. In order to do that, Cigna is requiring us to sign an authorization release to give Quantify the data. The data that they're getting is not identifiable. All the data is de-identified that they get. It's simply the diagnosis and cost items, no personal identification, but they do still require records. So we just wanted to let you know that that was in our plan. It's diagnosis code, so it's not any particular. So companies, Cigna, all of those health organizations use code. So they're going to get codes. So they're going to look at the codes for different things for those specialties. Where we're getting charged for hospital rates for people to go into the hospital for the day just to have their infusion. Where it's been, where the savings could be a lot greater to us if they can do those specialty drugs at home, infusions at home. This is not abnormal. It's just the first time Gallagher has asked us to look at something like this before, and I wanted to bring it forward just to let you know and get your thoughts, because if we don't do it, they can't go with Quantify to Philadelphia to see if there's any savings cost that could look like. So. And how everything's quoted when you look, when you don't get it, but all of our health stuff there's a code that goes to, different ailments that you have. Well, they just released the codes of that. And the cost associated, the billing cost associated to that. Quantify then takes that information, looks at that, and then is able to produce a report that said, in this past year, had you had Quantify that would have the infusions done at home, you could have saved $200,000 off the plan versus not, where we're trending 100, 200, 300,000 in infusion. And where our top categories right now is in the area of cancers. We have a lot of those diagnoses that are on our plan, as you can see on the stop look. They don't get any personal, it's not private. It's into like it's just a form. I could do that. I think you can help to just because cancer people that want to I'm the benefit administrator. I said I want this is something different than we haven't done before, and I would rather bring it to the board to get their take on it first before I take any other action. So I can go ahead and do Primex first, and then come back to you next week and give you. It seems like it's not giving any. It's not really physical issues, but I mean, both things are there. Like let's get like that. So I just might let's start with Primex. Sounds great. Unless you guys.
No, that's fine procedure. My concern is we adopt this plan. I suppose this is the future discussion. And somebody needs an infusion. They say, I don't want it. Are we going to be forcing the guy to say, no, you have to do the least expensive way and do it at home?
I'm not sure. It's just kind of gives us some data information first. This will be a part of our open enrollment, our benefit renewal, where they look at some things that they offer, Cigna offers, and it's talking points there. But yeah, that would be part of that discussion. I would have him have that information available. But to something the framework, like they may not feel comfortable. Especially if you're doing something some people might try to like. Have your hands off and getting.
Thinking it's gonna be.
Find out what the. What is this? What the potential confines for, like. if- Like. It's burning and why would you think that they- I'm coming from a different approach than, you know, like, from different, you know, it's been forward stuff that there, so I think that it's getting used to the change of there and what they bring to the table for ideas and stuff like that. So it's just a good idea. And my sort of some of the. People. My name is Amanda Kelly. I live in hospital. And I actually came to this building a month, 2 or 3 ago to have a meeting with Jen Hunt upstairs. And so it was really in full operation. We were just moving in. For COVID, removal and I have no idea what happened. I am.
Yeah, so.
I want issues in my health. So on my town budget committee, so everything you're talking about with your upcoming budget, we just Tuesdays. Jealous. What appears and I could be working, feel free to in terms of facilities. What appears to possibly be an oversight in the construction of the building. With regard to the state law that was passed in 2019 and effective in 2020, it's RSA 15580. And like I said, I brought some copies of the RSA and its definitions, which is RSA 15579. This is a law that requires universal changing stations, which in layman's terms don't not changing people. This is something that most people have no idea is a problem that exists in the world, but not all. Changed, and she will grow up to be a 26-year-old. Right now she's 80 pounds, but she's a big. And so the state passed this law 7 years ago, to accommodate this population. Very vulnerable. There are very few places in the state that people need caregiver assistance in the home can go, and not have to be changed to become. So parents of small children, in a wheelchair, have for years, since it was never included in the ADA in 1990, when from updated standards in 2001, had to lay their children on blankets or back and forth for teachers. Women was that has been picked up for people that are privileged to be able to do this in their car. See, you change her hair and van, and she's 12, which is not great privacy or dignity. And as they get bigger, you can imagine the caregiver of somebody who's 100 or 200 pounds is not going to be able to pick them up out of the chair. That's looking somewhere. So you become homeless. In the state, there are 9 entire state. There are 9 places you can go. And if I needed to, as I had to come here for a meeting, anybody have to come to the public building, is either the individual with the need, a caregiver of the person with the need, and they don't have a place for them to go, should be able to access. they have. Great job. You can see in the definitions that apply to retail spaces, of 10,000 feet or larger, library, to, theaters that or where they apply to all public buildings. The public building, here, meetings, just like the meeting rooms are to be spread public, it should have been here. Understandable. Really lesson rules, state Thursday, building people about it. I go around and talk to building people all the time, and it's I didn't know. I'm so sorry, I didn't know. I couldn't have enforced this code if I didn't know that. Luckily, the 2020 action building code now almost verbatim same language. Did a great job here. The building code the language. When the state of New Hampshire is going to adopt it. One code, then adopt. Obviously, that's not what that thing, but state laws. So I'm probably already did one. I'm thrilled, but I took a Jen. We did find this bathroom, there's a room down at the end of the hall on the left. She did not know that this was a room there. She was just wandering around and being helpful as she is. And it might be rehabilitation space. I couldn't tell. That space would fairly easily fit this law and be changed into what it needs. Look at your bathrooms and if you're reconfiguring them, it's a lot of work. So reconfiguring is too bad that it wasn't found by the building inspector. Sure. Thank you for them. Already going. Alright. Just second. Thank you. Good afternoon. We are back from non-public session. We had 5 non-public sessions, and I turn it over the floor to Commissioner Tombrello to make motions relative to the non-public session.
I'll make a motion that out of the 5 items, we share seal number 1 and 3 indefinitely due to the fact that they possibly could affect adversely the reputation of any person other than a member of this board.
Second.
Any discussion? Hearing none. Commissioner Godu?
Yes.
Commissioner Tombrello?
Yes.
And I vote yes. One more, Commissioner Tombrello.
I make a motion that we adjourn.
Second.
All those in favor? Aye. We're adjourned. Have a nice rest of your day, everybody. Take care.